And we are going to go ahead and record. So good afternoon, everyone, and welcome to today's Council on Black Health webinar entitled The Power to Be Well, What Works to Support Lasting Change for Nutrition and Physical Activity in Black Americans. Today's presentation is offered by the Council's Solutions to Diabetes in Black Americans Core. This core is part of the NIH-funded Center for Diabetes Translation Research at the Washington University in St. Louis. The Solutions to Diabetes in Black Americans Core provides methodological and content expertise to advance the field, advance the field of diabetes research in Black Americans. We appreciate you joining us this afternoon. My name is Melissa Witt Glover, and I am the Executive Director for the Council on Black Health, and I will be your moderator today. For those of us who aren't familiar with us, the Council on Black Health is a national research and action network that partners with communities, researchers, policymakers, and organizations who are all working collectively to improve Black health. Our mission is to develop and promote solutions that achieve healthy Black communities, and we leverage the credibility and perspectives of Black American researchers, other collaborators, and research partners to facilitate and lead thought and action around improving health and positively impacting Black communities. For today's webinar, we are excited to be talking about a topic that many of us who are in research and practice are concerned about is what works to support lasting change for nutrition and physical activity in Black Americans. I am so excited for this panel that we have. We're trying out something new with our webinars. We have two researchers and then two people that are embedded in the community that do practice-based research. And so we have the opportunity today to talk to them. We're going to hear from them through a fireside chat conversation. So you aren't going to probably see a lot of slides, but you're going to hear from our presenters, real talk about what works, what they've learned from their research and their practice, what works. We'll talk for about 45 minutes. We'll give you all an opportunity to drop questions in the chat. We'll have a conversation. And then the last part of the webinar, we'll have opportunities for each of our dynamic speakers to be in breakout rooms for you to go into and have an intimate conversation with them. That gives you an opportunity to ask additional questions. But importantly, while you have these folks on the line, you can ask them to help you with any questions that you might be struggling with your research or your practice. So today our speakers are Anne-Marie Stevens with Well4 Health. Thank you for joining us, Anne-Marie. Dr. Olivia Fuso, who is the Strategic Leadership Initiatives Director for the Council on Black Health. We have Dr. Mary Wilson, who is on the faculty at the Arnold School of Public Health at the University of South Carolina. And we have J.L. Alexander, who is the owner and CEO of the Vaughn Strategy, a branding and public health relations firm, and the creator of Black Girls Run. So thank you all so much for joining us. And we're just going to kick off the conversation today. So my first question is, and again, folks, if you have questions, we are monitoring the chat. Please drop your questions in the chat, but I'm going to start off. So my first question is, I'd like you to tell us a little bit about your work, the work that you are doing, and give us one specific strategy from your area that you've seen that's proven to be effective in improving nutrition or physical activity in Black communities. And let me start with, Olivia, since I know I can pick on you, let me start with you. Tell us a little bit about yourself and one specific strategy that you've seen that works for the area that you are focused on.
So I'm Olivia Afuso, and I've spent probably the last 30 years working in public health, really focused on how we can improve the health of Black people, particularly around physical activity and nutrition. More recently, my work has focused in the area of physical activity, and in addition to being a part of intervention work, so trying to get people to adopt a new behavior, I also spend quite a bit of time in the community engaging individuals around physical activity behavior. So I think one strategy that, that appears to be growing some legs is, having community. So being a part of some social environment that allows individuals to receive the resources they need to help them stay motivated. I think that's, one of the strategies that we're digging deeper to investigate how it works exactly.
So having community.
Community.
That is important. Okay, perfect. So staying with the physical activity theme and staying with the community theme, JL, can you tell us a little bit about your work, what you do, an important lesson that you have learned?
Absolutely. So super excited to be here. As she stated, I'm the owner and CEO of the national running organization, Black Girls Run. But I would say that we do, obviously with our name, we do focus on getting women in the fold with running. But I think it starts even before that, creating that sense of a safe space, transparency, and building that relationship before they even come out to a run. Once they come out to a run, we know we already have them hooked. So the work starts before they even show up. So creating that engagement, that transparency, that relationship, that safety and assurance that they are in a good space, that we are holding them accountable, that they can be comfortable with us, because we know it's very people have to be definitely very vulnerable, but also they're in a very protected, they're in a stage where they may be reacting to a poor doctor's report. They're just in a space that they may not feel, could be intimidating. So we want to make sure that they feel comfortable even before they show up in person. So just focusing on that relationship, but then also encouraging my ambassadors and our leadership in our groups to be just as transparent as possible about their own journeys as well.
I love that, and I really appreciate that. So we're kind of building on things. So community, and then that safe space and that transparency and that relationship. And I think that's important. But one of the things that you said is before they even come out, before they even enter the space, that has to be there. And for those of us who do research, and often for the Solutions to Diabetes in Black Americans Core, we get questions about how do we connect with communities, how do we engage, how do we build that trust. And so I'm going to guess, just to get your thoughts ready, that's going to come up later in the conversation, is how do you build that trust ahead of time? Because before people even show up for our research studies or our practice, we have to have that trust, and that's something we all struggle with. Mary, let's go to you. Your focus is on nutrition, and you've done some research on what works to improve nutrition in Black communities. So tell us a little bit about your work and one specific key thing that you've learned about what works.
Thanks. First, thank you all for the opportunity to serve in this capacity. It's just a joy and an honor to be on with such a dynamic group of Black women, all working in the field to advance the health of our communities. I have served as a research assistant professor and project manager for several research studies that include chronic disease prevention with our African American community members. And so there's a heavy focus on improving nutrition as a means to improve health. And we take that from a holistic approach. And so a couple of the studies that we're running right now, one is the Dietary Guidelines 3 Dietary Pattern Study, where our participants are randomized to follow one of 3 diets that are outlined by the dietary guidelines and provide we've gathered information and done some research to help improve the cultural components of the application of that. Also, the New Soul study is another study that we've been operating, and now we are in the dissemination and implementation phase of that, where African American community members are randomized to following one of 2 diets, one including a vegan diet. And the goals for these studies are to help address heart disease and diabetes. And so with that, I would say one key strategy, and ditto to everything that JL and Olivia said, so I'm gonna just go into diversifying my response just based on what's already been given. The environment in which you hold your interventions or in which you conduct your programming is as equally as important as how you're doing it. So for example, with our research studies, our intervention classes, where we are working with our participants to educate them on nutrition. We are talking about successes and challenges associated with following dietary patterns that can promote optimal health. And we are, conducting cooking demonstrations and allowing participants to get some hands-on experience. An environment that promotes the exploration and application of what they're learning is very important. And so all of our intervention classes are conducted in a teaching kitchen that we have at the university. And so that's kind of equivalent to like an analogy. If you're teaching, if you have a surgeon, their training needs to happen in the operating room. So if you're, talking about and trying to teach community members about cooking and improving their nutrition, it needs to happen in a kitchen. And so that is my one of the key strategies that I would recommend, just based on our experiences at the University of South Carolina and Arnold School of Public Health. We are, definitely promoting and making sure that the environment, first and foremost, is one where they can explore and apply what they are being taught.
Couldn't find my unmute button. Thank you. So the environment and where they're being taught and making sure that reflects what happens when they get back into their own settings. Thank you very much. That's very helpful. And then Anne Marie,
Yes,
you also do work in nutrition. And your focus is on practice-based. So tell us a little bit about your work and one thing that you've learned in terms of strategies that work.
Yeah, well, thank you. I'm honored to be here, and it's absolutely a privilege. I started life as a chemical engineer doing consumer-centered research at Procter & Gamble, and we have been applying some of those kind of best practices to the space of diabetes management for about 20 years. And so we also have a sister company, Precise Portions. We've built out the largest array of portion control nutrition systems for children and adults. And more recently, under Well4 Health, we've been building out an app and really developing a nutrition recommendation engine that's really focused on underserved communities, specifically people of color. We have been kind of honored a little bit like Mary. I want to go to Mary's Kitchen, by the way, but in kind of the spirit of the question, we have been recruiting for a clinical trial at the moment within a local community and partnering with the hospital in our area. And it's given us the opportunity to get a lot of FaceTime and, kind of one-on-one feedback in addition to our initial customer discovery work. The thing we have found is really building on Mary's insights is all in our world about flavor. And so we find that people are interested in healthier eating. So there isn't really a lot of friction there, but they just don't know how. And so we focus on what we call kind of breaking that intergenerational cycle. Sometimes we think we're passing along wealth or we're passing along whatever, but we don't always think about the eating habits that we're passing along to children and other family members. And so that's kind of the slant or the perspective that we bring to our work. And we find that that people really want to learn, because a lot of times they are going to leave programs, whether it's Weight Watchers or Noom or whatever, because they have had to sacrifice their favorite heritage food. So whether that is, I'm from Trinidad and Tobago, so it's cassava or yam or plantains. I am not giving that stuff up. I'm sorry. So our job is really teaching how you would proportion those food groups, those heritage foods, your culture, into the solution so that we have a sustainable kind of lifestyle behavior that we're teaching and encouraging them to pass it along to other family members. And so we've created a huge program around that, just that insight, and people are excited. And a lot of the approaches that we're taking are intended to kind of get people to like a low or no salt, or low or no sugar, low or no fat approach. So we are amping up like garlic and green onions and ginger and, just readily accessible herbs and spices as a way to really just allow people to continue to enjoy their heritage foods. But we're just teaching them how to, keep flavor, amp up, and share. Get kids involved in that shopping list. That's the thing I would say.
That is fantastic. And I see one question in the chat, which I'm going to get to, but there's also a shout out. Love that you're taking culture into account. That is huge. And that actually leads to a question, and anybody feel free to chime in. We know that there are many frameworks that we refer to when we're thinking about health in Black communities, and several of them incorporate culture and a cultural framework as we're thinking about improving nutrition and physical activity. Talk to us about the influence of culture on the success strategies that you've identified. How does culture play a role in that? Are there cultural factors and traditions? And please start, Anne Marie, and then others chime in as it relates to nutrition. And I'm curious, like, what does culture have to do with physical activity? Because there's no flavor there. So let's talk about that.
Hey, it's all about line dancing, JL, I'm guessing, but
Well, hold on. Sorry. We from a physical activity standpoint.
you're on mute. You went back on mute. Sorry. Okay, so for us, what we have found is when people are, let's say, at a party, it's like July 4th, let's make that up. And there's like, beans and sweet potatoes and, all these like great foods, and different family members are bringing in, I'm going to bring the collard greens, and I'm going to bring this, and I'm going to bring that. But if you are at the moment thinking, gosh, my blood pressure has been running high, those collard greens are always high in salt. What am I going to do? And you always feel left out. You're not a part of the circle. And so it's what we've been teaching, just from how do you make this sustainable, is you take charge of bringing the collard greens. You prepare it in that healthier way so that you are contributing, you're still a part of the family event. And you're still enjoying this thing that you love, but you can control, you bring it into your control. And that way you can still embrace the cultural celebration with the family, not feel isolated, not feel left out. And then, we have a way of we do like a coconut curry, sweet potato fries thing. And then what we want is people asking for the recipe. It's really all happening in the kitchen. So that's my shout out to Mary again.
So from the physical activity perspective, culture is definitely very important. And I think one of the things that's happened is we have shifted the culture around physical activity. And I'm sure JL can attest to this. The social norms of seeing Black women out running has completely shifted over the past 11 or so years, particularly with affinity groups like Black Girls Run coming on board and just creating just a safe space for us to be out there and also for us to come together. I actually had the joy of participating in probably one of the first Black Girl Run events in Atlanta. There was a 5K and a 10K in Atlanta. And that morning when I looked behind me and I saw thousands of Black women out on the pavement, it blew my mind, because from a research perspective, we were trying to figure out how can we get more Black women to be active? And it was Black women that were already active that brought more women out to be active. And I think that has really shifted the culture around the acceptability of more Black people being out and being active and engaging in a sport that has been predominantly represented by others besides us.
Go ahead, Mary.
Yeah, so I'll also jump in here. African American foodways is one of the things that we, talk about with our participants, which is, helping them to define what that is. It's basically just the intersection of food and culture in the African American community. And so, what does that look like? And as Anne Marie stated, when it comes to celebrations and cultural events, one of the things how we incorporate cultural factors into our intervention classes is that around major holidays, we adjust our curriculum to include how we are going to prepare for those holidays. And so hands-on cooking demonstrations with how we're going to prepare those collard greens now. How are we going to prepare the macaroni and cheese? What are some strategies to help us, continue to stick to our goals of why we are here in the first place? That's a very important part of our sessions. We develop SMART goals with our participants early on, and that's something that we have within our curriculum that's ongoing. So we revisit, revise, refresh, and we do focus on components in our SMART goals: nutrition, physical activity, stress management, and peer support. So we definitely, and if anybody has not heard of SMART goals, it's basically, you're writing out a goal that is specific, it's measurable, it's achievable, it's realistic, and it's time bound. And so that kind of helps with the accountability piece with our participants as they continuously develop and revise their SMART goals as it relates to their health. And so that's just an important part that contributes to the nutrition piece and identifying cultural factors that influence how they are able to continue to improve their lifestyle, improve their nutrition. Very hands-on, and we are not shy about talking about how they grew up and how we all grew up. We are not shy about talking about what we learned in grandma's kitchen and and what that means today. And we talk about, from a historical perspective, we talk about slavery and how, certain aspects have, are now incorporated into things that we do now, and how that's influenced our dietary behaviors and our choices. And we also address things from a mental health perspective as well. And so we bring in counselors, trained certified counselors, to talk about emotional eating and what that means and what that looks like, and how we are able to address that and make changes based on how we identify how we emotionally eat and what that means to our health. So several components there. We try to address just healthy eating, active living, stress management, just from that holistic perspective, even with the physical activity aspect of it. With our New Soul study, one of our first physical activity lessons that we did with our participants was soul line dancing, and just thinking creatively about what's popular in our culture and how we can incorporate that into the day-to-day. It is very important. So, and I know I'm giving a lot in this response and hitting on a couple different things. But, lastly, with the framing of all of that is also important. And so, we have to learn how to appeal to our audience and appeal to our community members. And we have to frame our messages in a way that folks understand, and it hits, the impact is heavy. So for example, with the physical activity lesson, one of the things, we also, research shows 120 to 150 minutes of moderate physical activity is what we are recommending that you do. What does that mean to somebody? I know what it means to me when I hear 100 anything. That's like somebody says, hey, I'm gonna give you $100. I'm like, oh, thank you. Like, that is a lot. I can do a lot with $100, not so much in the last 3 years, but we can still we can still make it work. But it sounds like a burden too when you present it from that aspect, like you need to do 120. You're not receiving something, you have to do it. And so I try not to communicate in that way with that particular message. It's more about, all right, let's go through this exercise. You all tell me, how many minutes do we have in a week? If about 10,080, is the response. I just make somebody take out a calculator, volunteer, and they do it. And so then I said, okay, so, how y'all feel about that? How about the minutes that you have in a week? Oh, that's, a lot of time. Yes. All right, so how do y'all feel about, taking only 120 of those minutes to 150 and dedicating that to improving your physical health? How does that sound? Sound doable? And mostly the responses are, yeah, that sounds doable. And I'm like, that's less than 10%. They ask, we're supposed to, give 10% of our finances. Like, I'm not even asking for 10% of your time with this. It's and the benefits associated. So, I'll let someone else chime in, but, kind of overall, it's a multi-layered approach when it comes to including and addressing like cultural factors. It's just not you just hit it from this angle only. You have to incorporate it in all aspects. It just has to be a part of what you're doing. It has to be, deeply ingrained in the work.
So in response to that, one of the things I will say is from the research that I've been working on more recently, instead of thinking about, okay, so what are the recommendations? How about going out and talking to people in the community? So my research project most recently was to ask women who are active, how many minutes are you engaging in? How are you able to do that? Who are you engaging in activities with? What are some of the things that allow you to be successful? And so that is the kind of information that we can use to help bring other people along. So if we know that, yes, some people who have less responsibilities can meet the 150 minutes, but then there's some who can only get up to 30 of the 150 minutes because they have these other barriers. We can still celebrate the fact that they have been able to do 30 and then help them troubleshoot to gain additional time in their physical activity, in their level of physical activity over the course of a week. So learning from the success of other active Black women, I think, can definitely help to support how we might provide strategies for women who are falling short. So maybe that's additional social support or from all different kinds of angles, and not just relying on family and friends, but maybe it's a group, maybe it's a virtual thing, maybe it's ongoing text messages. So learning from the people in our communities who are successful and how that might support someone else.
This is fantastic. I've got like 1,000 questions going in my brain, and so I'm going to try to center them. So first of all, let me just acknowledge in the chat, shout out to Coach Val. When we talk about learning from what works, apparently Coach Val has an exercise program that works, and I'm seeing some of your students that have been in that class are shouting you out, and people are asking if that is something that is virtual or something that we can get involved with. The Afro-Caribe, did I say it right? Afro-Caribe Dance Fitness. And so there is a link in the chat for those who are interested in participating. It looks like there's a hybrid model there for that. And so when we talk about incorporating culture, trying things in safe spaces, we now are seeing right here, just in this community, that is culture has been incorporated. People are already in the chat saying, I've taken it. And a lot of times that's how we show up for things, because somebody says, I went, it was good. Okay, now I feel good about going. When I went to my first Black Girls Run event, it was because somebody else said, oh yeah, it's for real. It really is Black Girls Run. And I was like, really? It really, and that's why I went. I didn't venture out on my own. That trust had to be there from somebody that I trusted. So shout out to those of you who are putting things in the chat. This is exactly what this community, what this means to help with community. One of the things that I'm hearing when you all are talking about what you're learning and incorporating culture, I am looking at the screen and making assumptions that you all have lived experiences as Black people who are practicing this healthy eating and physical activity. And so you are a part of the community, you have lived experiences. Oftentimes when folks are doing this research, everybody may not have lived experiences. And so sometimes when you're incorporating culture, it's not just from what you studied in a book, it's from your lived experiences. And so you kind of know what to do. What advice do you have? And Olivia, you said something important about you go out and you ask people who have been successful, how they did it. But what advice do you have for researchers who may be trying to develop interventions, who may not be part of the communities that they're researching, but who are trying to do disparities-related research? Where do they start? How do they figure out how to incorporate culture, and how do they do it authentically?
So I would say talk to the people in the community. So, try to establish relationships with people in the community. There are a wealth of individuals that are working within communities to improve the health of the Black community. So partnering with some community organizations and talking to those individuals that can bring together people from the community to ask use some community-based participatory research approaches where you actually spend time talking to people in the community. So you're not making assumptions at all. I mean, and as JL said, being authentic. So bringing your whole self to the community and say, you know what, I really want to help, but I don't know how, and I need your opinion. And, this is what we have to offer, and we'd like to engage. So just putting it out there, being upfront, and letting the community know what you don't know.
So I'll add, just building on that, having kind of had such a hard time recruiting, what we're learning is you can find those communities that Olivia has referenced, like health and wellness ministries at churches. You can find them at the health center at some of your local schools or universities. And many times there are community leaders who really, they care so much about improving the health and equity of their population. They are so eager to partner and just share insights and set up little coffee chats with their residents, etc. So those are just a couple of examples of how you might do what Olivia is suggesting.
I think that that's helpful. And one of the things I want to raise, and we always raise this when we think about community-based research, and particularly those who come from academic institutions, we get, we have to be honest, we get a lot of funding for doing research. We don't always share that equally with community groups. And so we want to be very careful and cautious and acknowledge that because I've heard two times now, go to the community, let them know what you don't know, and ask to be partners. But when we ask to be partners, we also have to recognize that we are not working for free. We are not volunteering for our jobs. And so we cannot expect that same thing of community groups. And so I just feel like I need to make sure that I say that, because communities are experts in their own communities and their own bodies, just like we are experts in our fields of expertise. And we have got to do a better job of acknowledging, recognizing, appreciating that, and making sure that we are valuing that. Mary, go ahead. I see you off mute.
Yes. So just a couple things. One is you have to, when you're doing work in the community and in the Black community, and you have to be able to tell your story, as you were kind of alluding to earlier. One of the first interactions that we have with our research participants after recruiting, we introduce ourselves, and it's just not like, hi, I'm Dr. Mary Jones Wilson, and I'm gonna be managing blah, blah, blah. It's, hi, my name, and why I'm doing this work is because growing up, my grandmother was a diabetic. Over the years, it got worse. She was a double amputee and was legally blind by the time she passed from diabetes. Me as a middle schooler, I was a part of her care team. My dad was an only child. She wanted to maintain a certain level of independence as long as she could before having both legs amputated and being legally blind. And so that would mean me and my older sister taking turns spending the night at her house, walking to school the next day, just so she wouldn't be alone at night. And firsthand, I saw the impacts of the disease and how it impacted her, but also how it impacted our family and our day-to-day decisions. And so prior to that, I was all gun-ho, like, I'm going to be a medical doctor. I'm going to follow, my grandfather's footsteps. And it clicked for me. And I said, something can be done differently here. We don't have to get to this point. So what is it that can be done on the preventative side of things? And that's why I decided to go into public health. And so when the first, interaction that, the community members are having with me, that's what I'm telling them. Because I want them to understand, like, oh yes, I work at a university, this isn't a meal ticket for me. I'm not here because I'm getting paid to be here. I'm here because I'm passionate about my work and I consider it a part of my ministry. And so from the jump, they understand, like, okay, like, she's really serious about this. She's had some lived experiences, and it's all about just trying to help motivate and encourage others to I let them know, like, how I've been raised. My dad, a lot of what he would tell us growing up is, if your health is the last thing you want to lose, it should be the first thing you take care of. And, like, growing up, I was just like, oh my God, like, can you please, like, how many times you gonna say that? I get it, like, but, I didn't get it. I got it as I got older. And it's been more meaningful in that way with applying it to my work. And so people have to understand your passion behind why you're here and why you're choosing to do what you're doing. And I'll go a step further. So our principal investigator, she's Dr. Bree Turner McGreevy. On our website, bree.net, you can find all of the studies that we're currently doing. She was at a community meeting and talking about, partnerships and grants and blah, 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 and how we can work together and what are some of the challenges. And it took a community member to stand up and say, well, we have all these projects about nutrition and healthy eating, but we don't have enough funding coming from, universities and working with universities that are invested in the Black community. And she thought about that thing and was like, you know what, you're right. So let me go seek out some grants that will do just that. So the studies that I've mentioned, they are all just for African Americans. And, sometimes we can get a little backlash about that in the media. But one of the things we do say is, like, there's a lot of research happening, and the research that we're doing with just strictly Black people is needed. It's a gap in research because we know that there is limited participation by African Americans in research, and that's historical, and we are very upfront about that. There's a lot that has happened historically that has turned off, Blacks from participating because of the mistreatment and the issues stemming from that. And so we're just very clear, like, hello, we have an institutional review board now. Our research is governed and regulated. We are, under oath to do no harm. And it's unfortunate about things that have happened in the past, Henrietta Lacks, and just know that that is not what we're about.
Yeah.
And research is needed because that is the only way that we can help change policies and help to alter practice by having us a part of the research that's being happened. We know what will work best for us. Because when you look at the demographics of a lot of research studies, you look at the population and it's just like you see, out of the 1,000 participants, only 1% was, African American. It's just like, well, it's not going to give a true picture of kind of like treatment options or what will work best for Black people if we are not even heavily represented. So we bring in those dynamics and say, hey, we are not represented well in the research at all. This is a way to help with that by saying we're only going to work with Black research participants for this particular study. And stand on that. And so,
That's good. I want to ask JL, speaking of people being represented in research. So you developed Black Girls Run, major organization. I am sure you are inundated with requests of, hey, you got a captive audience. Can you help us? So talk about what is that like for you? And if you had physical activity researchers coming to you, because I imagine, so I'm going to ask you how people can get involved with Black Girls Run, but then I'm also going to ask you, what's your response when people approach you and say, hey, we've got this physical activity intervention, you're Black Girls Run, can you help us recruit, and what should we be doing? Because you're a perfect
well, you skimmed the surface of what I had in my mind when we get inundated. That is the word, inundated with requests. And to be honest with you, the answer is no. And I want to tell you why. It's because sometimes those emails sound like they just did a Google search and we have an amazing SEO and they see us at the top and they click contact us. And the email is very like scripted, like, hey, this is XYZ from so-and-so. I have this dissertation I'm working on, or I have this survey. I'm like, right to the trash. Like, you did not connect with me at all. And you can connect with people through emails as well. I can tell if you've done the research or not. But one thing, Olivia has probably been one of the few people that we have worked with on an ongoing basis. But my reasoning for that is also because one, Olivia is in the work, but Olivia has also put in the time actually within our organization as well. So she has done it from both sides. So I don't want our researchers coming to us saying, hey, Jay, you have this captive audience. Well, don't just show up when you need us. You should have showed up before. But even if you didn't show up before, I'll still want to see and hear from you even after the research is over. Don't just come to our community when you need something from us. And I think, again, going back to my initial statements, building that relationship, like, hey, even though this study is over, how are things going? Or, hey, I met Mary doing this research. How is she doing? How are her grandkids doing? You've made those connections. And now you have a buy-in into the organization, not just from a researcher standpoint, but just from a humanistic standpoint. So I think that's the part for me, like, hey, I love getting those emails. I'm glad we're on your radar. But no, you can't just use us as pawns and just you just turn the page and it'll be another organization tomorrow. You have to build that relationship, whether it's for a research standpoint, but also that's how we build stronger communities. And again, going back to that a reoccurring theme of that trust and authenticity, that you're not just here just to kind of check off the box.
That I appreciate you saying that. And, I don't know all of the people who are listening in or all the people who might watch the recording, but I do recognize some of the names from community-based organizations. And I do hope that you all listened, heard that, and understand the power that your organizations have. So you are important partners in research. You do not always have to say yes. You can make sure that the needs of your organizations and the folks that you represent are met, because you all have been there and will be there long after research is over. And so I think that is so important that we, again, recognize, honor, respect, and value the work that folks and communities have been and will continue to be putting in. And of course, we want to make sure that research is wrapped around that, because making sure that things are noted as evidence-based is one way that we can disseminate, but we have to make sure that that is done in ways that value everyone. Olivia, go ahead, I see you.
So I just wanted to add that, community-based organizations shouldn't be shy about making sure that they receive appropriate compensation for their engagement. Oftentimes people come to the community with their hands out, but they're not providing financial support or shared power in the decision-making. And those things are really important. It should never be researchers coming to the community to grab what they can grab. It should be a win-win situation on both sides. Anyone that I work with, I make it very clear that, I understand the wealth of information, knowledge, connection, the trust with the people within a community. Those things are valuable. And, community organizations, I encourage you to push back if you're not being treated respectfully.
Yeah, I agree. And you just made me remember another point of an important part of our work as a university, working with community members. As it relates to our intervention classes, we set the standard with our projects, and that the projects where we are working with Black people, for example, we brought in, personal trainers, a licensed counselor. Sometimes we bring in guest chefs. We are very intentional that any business that we are working with, they are also Black. So the counselor we bring in, pay her Black. The personal trainers that we work with and bring in, Black. The t-shirts that we order for our staff, Black business. And so we have to, practice, what we preach, and show that we are setting the standard. It's just not like, oh, we just want to, USC is a PWI, and so, we have to kind of set the tone, like, yes, we are practicing kind of what we preach, and we take value in the Black community participating in this research with us. And we are showcasing that even by how we are, utilizing the grant funds that we have to help support the Black community as well. And we even ask of our research participants, even around, like Black History Month, hey, if you all have a Black-owned business, bring in your cards, bring in your flyers. We have special times in the program where we invite them to also share, kind of like what they're offering, any type of services that they're offering, so that, we it's all about support, and we try to showcase that in different ways within the study. And those are just a couple of ways that we do that.
That is fantastic. I'm going to switch gears real quick. I just looked at the clock. We have about 10 minutes before we move into our breakout room, so folks can ask additional questions. We have been talking a lot about individual level behavior change. So what can we do to help improve behaviors within individuals? Last week, I was in a meeting, and one of the participants said something that was so profound. He said, we can focus on individual level behaviors, but we have to remember there's nothing wrong with Black people. And we keep trying to fix us without thinking about the policy systems and environments that impact the ways that we behave. So as you're thinking about the work that you've done to understand what works to improve health in Black communities, have you learned anything about policy changes at the local, state, and national levels that might be needed to address root causes of why we are having to work so hard to impact nutrition and physical activity in Black communities? Anything that you can speak to from your work about what policy changes, because it's not, we keep pointing the finger at us, but it's not us. Olivia, I saw you immediately come off mute. So Olivia, and then anyone else, what are we learning about policies that we might need to impact to continue to maintain the things that you've learned?
So I think, one of the things that we noticed a while back as the social determinants of health became very important was that we needed to work on environments, improve the environments of the Black community so that people can engage in more physical activity. Things such as, trying to fix up the buildings and create sidewalks and create walking and biking paths and all these kind of wonderful infrastructural things. And some of that work has happened. That didn't necessarily translate to you build it and so then they will come. So I think that there's been, increasing focus on looking at the social environments. And, one of the things that we need to think about is policies that have led to the over-policing of Black bodies. And so I think we definitely need more work around that. So just because we have these new spaces, people don't necessarily feel safe to move about in those new spaces. And so like thinking about the social environmental research, what that does is allow us to think about how we can bring people together to help shift some of those policies away from over-policing of Black people in these spaces that have supposedly been built out for us. And I think, thinking about what JL and Black Girls Run has done is that by having this group that creates a strong social presence and social environment, it helps to allow more Black people to engage in those kinds of outdoor improvements, outdoor space improvements. And there have been quite a few other organizations, for instance, Outdoor Afro, which has allowed more Black people to spend time in nature because there's a creation of a sense of a safety among us as we move about outside. So I think there needs to be a lot more work that focuses on recognizing over-policing of Black people and then working locally and statewide and nationally of stop over-policing us. Just stop.
I'd like to add nutrition prescriptions. And so this is an emerging policy area in California where you are, instead of just getting like a script for metformin, somebody will actually take the time to say, here's a script for like your meal plan. And let us begin to first show you what your meal should look like. Let's take cost off the table, or let's take meal prep off the table. Just here's your prescription. As a first step in beginning kind of that behavior change journey. And so from a policy standpoint, that is something that I feel is practical and should be considered in other states as well.
Yeah, agreed. So, food is medicine, that entire movement is definitely just if anyone wanted to look up what Anne Marie was mentioning, just kind of Google food is medicine. But in addition to that, just like support for the Farm Bill, expanding Medicaid for healthcare access, that's something that has not happened in South Carolina yet. Also just support within the Farm Bill, support for the SNAP program, with the USDA and offering resources to members of our community who are living in poverty. So there can be a lot of, I would feel like, policies for economic reform to help diminish poverty in communities by helping to increase support for programs that help to move people from poverty to more self-sustainability. support for local farmers markets and local farmers, and also just, policies and processes, procedures that help connect public health professionals to the healthcare field. So the population health movement and supporting more of the connection and the collaboration, where there are a lot of hospital systems now moving to that model, and knowing that there are supportive resources in the community that can help facilitate more compliance with patients, whether it be medication, treatment plans. Even for us, it's really hard to talk about, food and improving your lifestyle. And, you have someone who might be living in a food insecure household. And so, with that means they don't really know where their next meal is coming from. And so one of the things that we do for our research participants, that's one of the standard screenings that we have as a part of like the intake and eligibility process. We are screening for food insecurity, and of those who are, fall on the scale where their level of food insecurity is higher, then we are reaching out individually to those participants and providing them with information on how they can apply for the SNAP program, how they can learn more about WIC and apply for that, and offer assistance in completing those applications if they need it. We send them low-cost grocery stores that might be in their area, or information on how they can get connected to one of the organizations we work with, South Carolina Food Share, where they can receive produce boxes for that is, produce that's kind of sourced regionally for low cost. And so, some of those factors are considered. And then also just, there's also a shift in reforming medical school curriculum, which should, happen all over. And it's just kind of disheartening for me a little bit, because, in a lot of schools, nutrition and public health can be treated more like an elective, or just like this basic 3-credit-hour course, when you consider, that these students who are studying to be physicians and primary care doctors, they're taking over 100 credit hours, and maybe only 3 of them are related to like nutrition and health. And so, and some of them have the option of, they might take something else. But it's just such an important part of the risk factors nutrition is, as far as like chronic disease, that it should just be a standard. Like everybody needs to have that. So, that's just another way to kind of look at policy change. And so one of the things that we do, we present at different conferences. One, for example, is just like the American College of South Carolina Physicians, where we talk about our research and talk about ways to partner, and talk about, the results of our research studies, and the dietary patterns that were recommended, and the changes that were reflected in our participants' blood pressure, cholesterol, their weight, and just delivering the information to them firsthand, so that they are more aware, because, physicians, another, policy change that can be worked on, they're not paid to, or necessarily qualified to provide nutrition education to patients. They can't bill for it. There's limitations on how much time they're going to spend in the rooms with the patients. And so there's a lot of factors that go into that. So, we have to start somewhere. But the goal is, the research and translating that into practice. And so that's just one avenue, like in the medical community, because they are, physicians in the, medical field, they are kind of dependent on public health professionals to kind of give them the research, so that they can, kind of help move forward with some changes in their own way. And sometimes that even has to happen like at the practice manager level. They need to understand. So, those are just a couple of things. We've done a lot of work. I can remember when South Carolina, when it was passed, where obesity was then able to be coded as a condition, and I'm not that old, so it's just like, wow, that only happened just not too long ago. So we've definitely made some progress, but we still have a ways to go. So just a couple of things there.
That is really helpful. And I'm going to ask one last question. And then we just realized we don't have the breakout function. So we're going to open it up for questions for everyone. And you all can just raise your hand and we'll call on you. But just one last question. And I'm going to start with Anne Marie and JL, and then I will invite Olivia and Mary to respond as well. So as someone who is a researcher, and I imagine that there are other academics on the call, what can researchers or academics do more of? What can we do better? What can we do differently to contribute to the important work that you're doing when you're interfacing with the community for lasting change? Mary, you gave us some great examples of things, but is there anything else from your perspective that we could be doing better, more of, or differently to contribute to the work that you're doing?
I would say that we have to start with the data, and the data shows that apps are really sexy. Everybody wants to work on an app, but when you look at the data, we still see a crisis that is just burgeoning, which says apps by themselves are not going to work. And so I think we have to defy kind of those kind of buckets of like, kind of this is what's getting funded, therefore this is what we're going to do. And we have to kind of break out and really approach the problem from the root cause or root causes. And if we do that, we are in safe space. But when we just follow the crowd, we just end up kind of churning out the same old, and getting the same old results, which then there's no problem solved. So that is the thing I would like to encourage everyone to do.
Thank you.
I think one thing for me, and I'm not a researcher, I'm not in academia, even though my mother is a retired professor from an HBCU who taught health and phys ed. So I understand data and coding. She had me doing that when I was like 7 and 8 years old. So I do understand it, but I think sometimes looking at the tone of the questions, once you're able to get past that door and that threshold of working with our community, the tone of the questions, how we ask a particular question that is not in a negative tone, like, using phrases of, obesity and things of that nature. Like, yes, we are aware our community has these chronic problems. You don't have to tell us, we're aware of it. But how can we kind of change that tone of conversation to be a little bit more positive, more optimistic? How can we work together to create a solution versus our community being the problem and the solution? So I think just kind of how you approach it, I think that makes a difference. And, I don't know if questions can be, I know some questions have to be phrased particular ways to capture the data that's needed, but the ones that are a little bit more flexible, just being very cautious of how those questions are asked to the community.
I just want to echo that. That's spot on.
Very good. Olivia or Mary, because both of you are researchers, but also a part of community groups, anything that you would encourage researchers and academics to do more of, better, or differently to contribute to lasting change?
Yeah, one that I just always echo is no matter what population you're serving, ensure that your staff is reflective of that. We have our interventionist who is teaching our classes for our research studies. She's a Black chef. It kind of impedes upon some of the cultural considerations if there was anyone else that could not relate to the culture who was teaching the classes. So having staff that is involved in the day-to-day operations and the implementation efforts, have the staff, ensure that the staff reflects the population that you're serving. And that comes with sometimes a lot of different ways where you have to recruit for that staff. Everybody is not going to be looking at the USC job board, who we need. And so we have to creatively recruit and find the folks that we need. So that's sharing things across within your own networks, and also asking previous participants. So one of the things we've done, like when we hired a new nutrition interventionist for our classes, I had, a member from the community who served and participated in one of our previous research projects serve on the interview committee, because they have that perspective as a participant to help us identify who would be great to stand up in front of our participants and teach them some of the lessons that they need in order to be healthier. So, involving the community members at every level as well. We also have a community advisory board for our projects, and they are, leaders in the community in different capacities. We have a pastor, we have a radio personality who's very popular. We have someone involved in food policy work locally, and we have someone else who's involved in food access with connecting folks to, fresh fruits and vegetables. And so, those are just some ideas where we just kind of have to showcase, like, again, the trust factor here is very important and always will be. So multiple angles you have to approach it from.
So I would say that as a researcher, taking a different approach, instead of coming into a community from a deficit lens, approach the community to see what good is already happening in the community. Kind of piggybacking off of that comment that was made that, there's nothing wrong with Black people. So, what are some of the positive things that are already taking place within the Black community? Where are people coming together to find food options and options for physical activity, and what programs that are already there existing that are working well? So I would say, ditch that deficit lens and come to communities with that asset focus. Like, what's working here? How can we leverage that?
Thank you very much. And so this has been fabulous. I see folks are getting off, and there are people who are reluctantly getting off because they had things scheduled for 2:00. But we are going to open the floor now for questions for folks, and I'm going to turn it over. Olivia is our strategic leadership initiatives director. She is going to actually lead the discussion, and we are just changing the appearance now so that we have everybody in the viewing gallery so we can all participate in a group discussion. And Olivia is going to moderate, and I'll just start off with I'll just say there are 2 questions in the chat right now that we can answer. I think one early on was for Mary, way early on, was if you could provide examples of outreach campaigns, social media or otherwise, that were used to promote the cooking classes that you mentioned earlier, and which ones of those campaigns were most effective and why. So we'll just start with that question, and then we will invite folks to drop questions in the chat or chime in, and Olivia will moderate. So Mary, go ahead with your answer, and we will move forward from there with questions.
Okay. So we found it very helpful to work with a graphic design artist who was able to capture in a creative, eye appealing manner our flyers and how we delivered them across and shared across social media, shared within our networks of partner organizations in the community. Restaurants where people are going to get food, flyers were shared there and available at restaurants where, they prioritize healthier options. The most effective strategy that we used for recruitment was radio. And I was just very strategic in identifying radio stations that had a predominantly Black population or listening audience, and utilize that data to strategically pick which stations we were going to run ads on. And that has been our number one success for recruitment, radio. And then being able to have interviews with some of the key radio personalities and come on the show live and just talk about it, give folks an opportunity to call in and ask questions. But then also utilizing local TV anchors who are popular and have popular daytime or evening shows, and getting on some of those shows and being interviewed and of course, a part of that too is just having an ongoing presence in the community and having someone in a role where if they are doing most of the recruiting, like they're pretty well connected. So when you hear the name, it's just like, oh, I saw her in the community at this event, or I saw them at this table, or I heard it on the radio and now I see their face. So radio number one. It's a great investment. Have a budget for it. Keep it in the budget for any and every project that you have, because it's worth it. It's worth it.
Thanks, Mary. The floor is open for additional questions. So if you could put your question in the chat or raise your hand and ask your question. And if you would like for someone in particular to respond to your question, throw that out there as well. So I'm looking to see if we have any questions. There was one question about whether or not any community organizations were using focus groups to receive feedback, and if so, in what capacity. That question came from Whitney Downs. So Jael, would you like to respond to that?
We haven't done any focus groups. To be honest with you, if folks do reach out to us looking for information, not even from a research standpoint, we have, for lack of better words, captive groups within the larger group. So we have Black Girls Run ambassadors, which is kind of our leadership level within Black Girls Run. We have run coordinators. These are kind of our boots on the ground women that meet the women for the runs. And then we just launched a brand ambassador influencer program within Black Girls Run. So these are women that are within the organization. They're not just showing up, but they want to take a deeper dive into engagement of the organization. And so very often if we have folks coming to us looking for information, this is kind of my first kind of like, hey, we definitely have, a few hundred women that I know will show up and give you what you need, that they're just not coming out to the community run. They're actually engaged at a deeper level. So, but we have not done focus groups before. That would be interesting to see what that would look like. And of course, we have groups across the country. So very often I'm always asking, well, what are the markets you're trying to target? Northeast looks very different from West Coast in terms of activity level, access, financial, all of that. So we definitely have to do a deep dive in terms of, markets that you're trying to target as well. So hopefully that answers the question a little bit.
Yeah, so I have a follow-up question to that. So within your own work, of the work that you're doing with Black Girls Run itself, how do you really know what the women want and, provide that safe space and to help to keep the movement going?
Good question. I really do use my ambassadors as kind of my ears and eyes on the ground. Obviously, I'm in Richmond, Virginia. And so, I don't know all that's going on in Charlotte or LA. So I really do communicate, hey, it's an open door policy. If you think about something, if you want to see something, please reach out to me because you know your community better than I. But then also just kind of looking at the larger organization and just talking to people. If they tell me, if we're talking and something pops in my head, then I want to, get feedback. So just having that, just, basic communication with people of what they think and getting their feedback. But I am very much a visionary leader, but I still get pulled into the weeds for things as well. But I guess I also understand where the organization is headed and what we're trying to accomplish, so that I have to make sure that we stay on task with the bigger mission of the organization as well.
Awesome. Thank you so much for that.
I'm sorry, Olivia, I do have something to add as it relates to focus groups. One of the ways we utilize focus groups within our research, so for example, with the DG3D study, dietary guidelines, 3 dietary patterns, we receive funding to kind of assess and implement and help our participants adapt those dietary patterns. In our first cohort with that was specifically focused on us delivering recipes and the dietary pattern exactly as the dietary guidelines presents it. We held focus groups at the end of that intervention to provide heavily cultural considerations to what and how the dietary guidelines communicated information, delivered the recipes. And part of the funding and why we're funded to do that work is because, the dietary guidelines, they are looking to us to receive that feedback from our focus groups on, some of the issues. One of the main issues that came out of our focus groups as far as cultural factors that are important as it relates to the diets and kind of like the nutrition aspect and the recommendations was dairy recommendations through the dietary guidelines, and how with a lot of Black people have a lot of dairy intolerances. And so, it's just, you look at my plate and it's just like you have a section where you're expected to consume dairy. And so the ask was from our participants, plant-based options to be able to fulfill those dietary needs outside of telling them to eat dairy. And so, that's one of the things. After our first cohort, we utilized the results from the focus groups to then conduct the next cohort, where we implemented and incorporated a lot of the changes that they recommended, cultural changes that were recommended into the curriculum, and revised recipes, revised curriculum. And that is going to be written up, of course, and shared with our final results. But focus groups are is a way that we kind of incorporate that into all the research that we do. It's a means of how we are also able to improve our interventions for the next time. And it shows that we are valuing our participants, and they're just not like bodies, like we're just asking you to do all this stuff, because it can be a lot, and it's not like we're paying them for their time. So it's like we have to make sure that they understand that they're valuable and that their responses are going to make a difference. And we point that out. You all said in these, focus groups that this is what you observe, this is what you want to see done differently. And we kind of highlight how we've incorporated those changes. And then someone mentioned it earlier on, JL, just, telling community organizations, we want to hear from you after this, right? So also one of the things that we do when our projects are over, and we have taken the time, and usually it's like a whole year where you have to do the data analysis and, getting all the results together. We brought our participants back and invited them back for a presentation of a results reveal is what we called it. We had some chefs came and do some samples for us. We brought back in some of the facilitators that would talk with them about the challenges and successes they would have participating in the research, that were also community members, to kind of talk with them. And so it's like, we want to make sure they know, like, we still care about you, because that's also a means of how we recruit for our future research studies. We go back to our same folks that have completed programs with us, and although they are not eligible to continue to participate in new studies, it's like, hey, come back, see the results. Hey, we got this new study. You have family members, you did well. Can you share this with your family or your friends who are looking to kind of make some of the same changes you were? We can help them. We want to help them. And because they're like, you know what? Dr. Wilson, they were so nice. They took care of us. They, made us feel like people. They're more inclined to kind of also now, they're not official ambassadors, but that's what they are unofficially. That's what they kind of become. So just, that's what I would recommend for any other researchers wanting to kind of engage in this type of work.
Okay, thank you. So I wanted to shift to Anne Marie and ask you about, how do you engage the people in your practice? And I also, there's a follow-up question for you in the chat. Someone asked, Coach Val asked, are there any healthy soul food or Caribbean recipe books or website recommendations? And I thought you might want to respond to that.
Oh, that's great, because that's like totally in my lane. So the answer to both questions is back to that kind of flavor. So we have actually created a line of salt-free spice blends. We also do infused olive oils and balsamic vinegars. We have been really using them as a way to showcase how to get 1/2 of the plate veggies tasting nice, as we call it, right? And so with engaging in the community, that's where we start. We start with flavors. It's been really fascinating, because we're actually starting with just what I would consider kind of basic herbs and spices. So we're talking about garlic and ginger and green onions, and just like how to do. We focus on 6 ingredients or less, 30 minutes or less.
So tell me, but where do you find the people to taste the spices and the
Yeah, well, and so in our kind of engagement with our community leaders, they have actually helped us like brand this as tasting tours. So we are going around the neighborhoods, and they themselves help with the marketing. And we show up in partnership with our EVMS, our hospital partner. The hospital tends to do kind of free A1C checks and free blood pressure checks. And we do free tastings, and we talk people through how to do those, quick meals that are really healthy. We focus a lot on teaching them about healthy snacks. Here's the protein. Here's a quick and nice, easy way to do hummus. Here's a little, raw. We never say plant-based, because we know they're going to think, oh no, that's totally not going to taste great. So we just call it what it is. Here's like hummus, and here are the 10 ways you can make hummus taste amazing for like, less than $2 or something. And
So let me ask you, do you have like feedback cards where you're getting people's feedback on whether or not they like something or which things they like more? Like, how do you develop your product lines for people to try?
so great. I'm going to take that one back, because we do not have that formal feedback loop. Instead, we started with this is just like in my culture, in our history, we know that people love jerk. So I didn't have to do any research on jerk, or we know people love curry. And so there are a couple of flavors we have kind of, we just know from like, 100 years that, yeah, these flavors kind of go a long way. And if somebody doesn't like the spice profile here, they will like this one. So we have the range, and we've actually been selling these for the past 6 years. So we also get a lot of that. Mary mentioned the farmers markets. We're always in farmers markets, and we get a lot of one-on-one feedback. So nothing written, but really verbal, face-to-face interaction. And then we take kind of, oh, that dish worked well. Let's take that into the community, which is where we do that for free. What we find is that when we start with flavors and we show that it doesn't have to be expensive, it doesn't have to be hard, it doesn't have to take all day, it doesn't have to be something the kids are going to throw away. When we debunk some of those myths or belief systems, That's one of the ways we are able to build trust. We use their palates as a way to say, it's okay to get rid of salt, it's okay to get rid of this, okay, but taste this. And when they're like, wait, where's the recipe card, you know? And they're in. And some people, they try it at home and they come back and they're like, well, you know, my kid ate that. And the kid is always the test. That's the litmus test, right? Because if Joey is going to eat it, it's okay. If Joey wants to toss it out, we have a harder, you know, a higher hill to climb. But so we tend to use the flavors and those tastings a lot to kind of gain trust and also to really educate on how to still enjoy great flavors, still enjoy your heritage foods, but without salt, a lot of salt, without a lot of sugar, and without a lot of fat.
Thank you. Thank you. So we're getting close to the end of our time. So I would like to go around the panel. If there are no additional questions from the audience, to ask, what is one thing that you see as a success in the community in which you work, and how might other people build off of that success? So I will start with JL, and maybe she can kind of help us wrap this up.
I think one area of success and probably just giving us hope is that there is a need for our work. When you feel discouraged or you feel like you kind of hit a brick wall, or like, why aren't people showing up? And we go through the same thing. People, you know, health and fitness ebbs and flows. If it's cold outside, if it's hot outside, you know, it has to be the perfect presentation sometimes for Black women or just Black people to participate in something. But I think visibility and consistency and knowing that the work is needed and it's necessary for our communities to get to move forward and become healthier. So just kind of keeping that in the back of your mind is just kind of the power, the backpack, just to keep you motivated through this work. I think that's kind of something I tell myself over and over again as a community leader, that we just continue to show up even when no one, even if feel like we're in an empty room, just continue to show up, be consistent, and be visible, and people will come. So I think that's kind of my advice for just everyone in this space.
Thank you. And Mary?
Well, what I'll say is just don't underestimate the power of peer support. Having and holding research or operating programs in an environment where there can be camaraderie and folks who are experiencing some of the same issues and want to go in the same direction. That's very powerful, and it takes a lot of weight off of the staff or the researcher, implementer, program personnel, just kind of instantaneously, because it builds a level of accountability amongst the peers and a level of support that they feel where, you know, even if you're not approaching it from you need to do this type of perspective, they have those people that's going along on the journey with them who can serve as an added layer where they might not be showing up to see Dr. Wilson or whoever else's staff who's our interventionist there. They're showing up because, you know, Melissa's always sits next to them in the class and they don't want to disappoint Melissa. Melissa's going to call them and say, hey, where were you today? So peer support, it is half the battle. If you can make sure that whatever work that you're doing, where it's not more of an individualistic approach, it's more from a group approach, your work is more likely to be more successful, more sustainable.
Thank you. So we're at our time, but I'm going to let Anne-Marie have the last word.
Awesome. I take that responsibility very seriously. I want to leave everyone with this idea of removing friction. And what I mean by friction, it's a physics word, but it's not that hard in the sense of if counting calories is hard, that's a lot of friction. And so I have found that it's a lot easier to tell somebody to eat 5 colors of the rainbow and call it a day. Let's just do 5 colors of the rainbow, forget about counting calories, let the app do that, and I think we're good.
That's great. Thank you. Thank you. So I want to thank everyone for their participation today, particularly our other panelists. And I will give the last word of saying that just continue to show up. We have the power to help our communities to be well. And so we should leverage that and never lose sight of that. Thanks everyone for being here. Thank you. Bye-bye.